Welcome to Sports Ophthalmology, a podcast for ophthalmologists and trainees interested in providing eye care to athletes. I am your host, Jared Tuttle. Join me as we hear from national leaders in this exciting subfield of ophthalmology. Dr. C. Ellis Wisely is an assistant professor of ophthalmology at Duke University Eye Center. Dr. Wisely received his MD and MBA from The Ohio State University and completed his ophthalmology residency and a fellowship in cornea and external disease and refractive surgery at Duke Eye Center. Dr. Wisely serves on the Duke Residency Interview Committee and is an active proponent of resident education. Dr. Wisely is an affiliate of the Duke Sports Vision Center and consultant ophthalmologist for the Duke men's basketball team. All right, Dr. Wisely, thanks for coming on today.
Well, Jared, it's my pleasure. Thanks for having me.
So how did you get involved in sports ophthalmology?
So I first got involved through my mentor in the cornea division at Duke, Terry Kim. He got me involved while I was a resident, and during that time, I started helping him with the eye screenings that he does annually for the Duke men's basketball team. And Terry has been doing that for a couple decades now, where all the incoming players will have baseline vision exams. And I helped out with that each year during my residency. And that led to some research endeavors with Terry, wherein we're looking back at some of the findings from the eye screenings and also at some of the traumatic injuries that he had dealt with over the years. So really I have to credit him for getting me involved.
Great. Yeah, we'd like to hear a little bit more about that study later. As far as sports ophthalmology in general, how would you kind of define that idea, or would you call it a subfield within ophthalmology, or how would you kind of define that?
Yeah, I think that's reasonable to call it a subfield. I think sports ophthalmology I regard as a pretty general term. I think it encompasses a few different things. I think it encompasses prevention of ocular injuries. I think it encompasses the care for ocular injuries that occur during sports. And then I think it also includes a different category that some people refer to as performance vision, which is training athletes with normal eyes and normal brains to unlock the potential for improved performance during competition. So it's training that includes some vision-based elements that help you to excel.
Got it. Yeah, we've kind of talked about some of each of those parts and different guests on our podcast as far as the protection side of things and prevention, and also just the care, the in-game care, and some of the screenings we're going to talk about today, and then also that performance vision enhancement. What would you say is your favorite part, or what are some of your favorite parts of sports ophthalmology?
I like several different aspects of it. It's hard to pick a favorite. I really like screenings because, it's sort of an opportunity to catch the low-hanging fruit, so to speak. So when you do a screening, somebody who's already performing at a high level might recognize that if they were to start wearing contact lenses, they could, achieve an even higher level of performance, so you catch some easy ones and get some wins in that regard through screenings of healthy athletes. But I enjoy taking care of ocular trauma patients as well. Usually when patients have an eye injury, it's a very stressful situation for them when they're an athlete. They're worried that they may not be able to recover fully, but especially with basketball, which is the main sport that I deal with, we're lucky in that the vast majority of injuries do not have serious long-term visual sequelae. So, that just creates a situation where a lot of the time we're able to provide reassurance and tell patients that they're going to get better pretty quickly. So that's a nice feeling as well. I think my least favorite part is breaking bad news to athletes who have the rare athletes who have had severe and long-term vision impairing injuries. That's certainly the least fun part, but luckily it doesn't happen very often.
So how would that conversation kind of go um, with breaking the bad news? Does that mean that maybe they won't be able to achieve the athletic goals that they're hoping for, or what kind of things are discussed?
Yeah, of course, it's situation specific, but I would say that in the short term with the injury, the most important thing is to, just as it would be with any patient, not just the athlete who had an injury that's vision threatening, but any patient with a vision threatening injury, is to let them know that you're going to be there for them and that you're going to, be there and follow them closely and work with them through every step of the way. That you're going to get all the right people involved. Like, for example, with me, I'm a cornea specialist, and if they have a retinal detachment or something like that, I'm going to help them get to the right place. Um, but specifically, um, yeah, the hard part is, if you're talking about a serious impairment in vision for long term, that at some point there may have to be some adjustment of goals, and it may hinder their goals in their sport, certainly, which is the worry.
For our listeners, do you mind summarizing your retrospective study of screenings and eye injury consultations on the Duke basketball team?
Sure, I'd be more than happy to do that. So, this is a study wherein we had, just as you mentioned, Jared, we had two goals. We wanted to, one, describe the screening of healthy athletes that we've done at Duke over the last 16 seasons, is what we looked at. And we also wanted to summarize the uh, ocular trauma that we've taken care of specifically in Duke men's basketball players in that period. And so, in screening all the players that were on the team in that period, we found a few things that were pretty interesting to me. One is that about 30% of all the athletes, and again, this is athletes performing at a really high level in what many people view as a vision intensive sport, basketball, 30% had either uncorrected or undercorrected myopia. So, a lot of people going around not seeing 2020 who are fully capable of it and did still performing at a very high level, which is kind of shocking to me. But with proper correction, everything that was dealt with in this cohort, of course, and hopefully led to even further improved performance. We did also find through our screening exams a couple of more serious ocular conditions, which you screen a large population. Perhaps that's not so surprising that you find a few serious things. Another thing of interest was that in terms of looking at everybody that was on the team throughout this time period, eye injuries are very common, which I think most of us who work in sports ophthalmology know that about basketball, that it's the that most commonly involves ocular injuries of all sports in the U.S. But almost 9% of all the Duke men's basketball players in this period had ocular injuries that required a consult with an ophthalmologist. So not just something where they were assessed on the sideline at the game, but nearly 9% had injuries that led to an office consultation with the ophthalmologist. So pretty common thing to happen during their tenure at Duke. Luckily, as I kind of alluded to before, the vast majority of those injuries were not serious in terms of long-term vision threatening outcomes. So there was only one athlete injured during this period that we looked at who had an injury that led to a visual impairment. So that's the long-term visual impairment. So certainly that's a good thing.
Yeah, I think it can be hard when we talk about protection and prevention. Maybe a lot of these athletes have gotten hit in the eye and they turned out just fine, or whether that it needed to get consulted to the ophthalmologist or uh, their trainer or the other provider that they have looked at it, said it was fine. They feel like their eye turned out fine. It can be hard when the very rare occurrences um, are the most influential or traumatic ones.
That's right. And I think we take it for granted that we're going to get better with a lot of these injuries because you're saying that's been people's experience. And the I I think that in terms of prevention, we really need to start with our school age, uh, you know elementary and middle and high school age athletes. Start from the beginning and create a habit that the parents can be involved in as well. And that's why there's a joint statement that's been out for a long time, for 20 years, I think, but from the American Academy of Pediatrics and the American Academy of Ophthalmology, saying that they recommend for all school age participants in basketball in particular that they wear eye protection. So certainly that doesn't mean that you go to youth league basketball and you see everybody wearing eye protection at baseline. It's not the way it is there. Um, but it's just like you're saying. It's unfortunate that, and when you look at the professional level, really the only guys I can think of who in the NBA who wear eye protection are guys who've already had severe ocular injury. So one guy who wore it forever, of course, was Amari Stoudemire, wore protective glasses, but that was after he had a RD. So it's something that prevention would be a solution, but it's a difficult sell.
Yeah. How does the sell for glasses or contacts normally go? You mentioned that a lot of these athletes are myopic. Uh, are they eager to try it out, or are they kind of hesitant um, to try their sport with glasses or contacts, or how do they generally react?
I've found most often the reaction is they take it in stride, don't seem to be bothered by it, particularly with our college athletes. I think they're all eager to, if you couch it as this could give you an edge. I think that they're eager to take anything that they can to optimize their performance. And contact lenses, for the most part, are not a scary prospect for college students. Pretty common. So we have a good contact lens partner in our community who does those scripts for us. So I haven't really found a problem with that. There's one athlete I can think of in the last several years of our screening program who just found he could not tolerate wearing contact lenses and ended up just continuing to play uncorrected and play really well, but just didn't like them. So for the most part, people adapted them well.
Yeah, I think that having that conversation with the athlete, referring them to good contact fitters, that'll help them know that you're on their team, that you understand their sport, and that your intervention can help them to get to that next level. I think that's great. What are some of the essential aspects of an effective screening?
When we do an eye screening, we try to do a comprehensive eye exam. So we include, of course, visual acuity, intraocular pressure, um, motility exam. We do a slit lamp exam. We do confrontational visual fields. We do a direct ophthalmoscope exam of the posterior pole and the optic nerve. So we do pretty much everything except for dilation and refraction. If we determine a refraction is needed, we refer for that. But we try to do as much as we can and be as thorough as we can. And that we usually set it up where we have 7 or 8 doctors at different stations and bring the whole team through. I think the key is trying to make things as efficient as possible for the team, because they're not looking to have each player come and spend 45 minutes at the office separately. That clearly won't work. So we go and we set up in the practice facility, and we bring 7 or 8 doctors and we just move everybody through rapidly. We each sit at a station. So maybe I'll sit at visual acuity and start everything off and then move them through stations where they do each of the other tests. So it usually works very well.
What are some of the benefits of having that full comprehensive exam rather than just the screening chart screening test?
Yeah, so in our screenings, we found, I mentioned the myopia that we found, but we found also decent number of patients who were glaucoma suspects. So, of course, the pressure and then the direct ophthalmoscopy is how that was diagnosed with, maybe cup to disc asymmetry or ocular hypertension. So those are things that would be missed, of course, with just a Snellen visual acuity testing. So that's a big benefit. We've also detected some patients who had keratoconus, and so that's benefit of having the slit lamp exam. So
I wanted to speak a little bit about residency and ophthalmologist education. Is there any sports-related training in residency programs? And in your opinion, should there be? What kind of discussion could there be for education in residency programs?
yeah, that's a good question. I mean, so not to my knowledge, I would say it's a pretty small and niche field. Sports ophthalmology is, for a few different reasons that it's small. One is that um, most of these issues that arise in terms of traumas that come up, as we mentioned, are tend to be not serious in the long term and are cared for very well by general ophthalmologists and even by many optometrists in our communities. So, it's something that doesn't necessarily require a specialized background and training just to deal with sports. If you've had a reasonable exposure to ocular trauma and care for ocular trauma during your residency, I think that you can take good care of these patients. And that's where most of these patients probably end up. To be frank, many of these patients probably get care in an ER and don't even make it to an ophthalmologist, because corneal abrasion being the most common in many settings will get care from a general ER doctor and never be seen by an optometrist or ophthalmologist. So, in many cases that can be adequate. I would recommend that those patients that do have an abrasion are referred to ophthalmology, but in many cases they turn out just fine if they're not. So um, I think that because there's not a huge number of opportunities for jobs in sports vision as well. There's not many teams that can really support somebody to do that consistently. Mostly just professional teams that have consultants engaged consistently. So there's just not a ton of opportunities. So I don't know that it makes sense to have specific training in residency. And I think if you train in residency at a program where there's a trauma center where you're seeing ophthalmic trauma of all kinds come in, you'll be ready for anything that comes from sports ophthalmology.
Where do you see the field of sports ophthalmology going in the future?
That's a good question. I think that there are a few different things that we'll see, but primarily, I think that training and specifically performance vision that we were talking about earlier, which is taking athletes who don't have any sort of issue with their eyes and they're trying to um, do things with their vision that'll optimize their performance. I think you'll see performance vision be the area that's really going to grow. I think specifically that's going to grow in relationship to wearable devices and augmented reality devices. I think that both Apple and Google are probably will make a big splash with wearable augmented reality devices in the next 5 years, not just for ophthalmology or for sports vision, but for um, just the technology that we use in our day-to-day lives. I think you'll see a lot of people with glasses and contact lenses that can create an augmented reality situation for our daily lives and for sports vision training. So I think that's going to be the next frontier.
Kind of like the Iron Man idea where there's like the screen there. Is that what you're kind of talking
Definitely,
about?
yeah. And there it's I think it's possible to, for example, if you're um, working out in basketball, shooting in the gym, and you're wearing one of these devices, these glasses that do augmented reality, they can make your drills more difficult by presenting obstacles in your field while you're taking jump shots or whatever. So I think that there's a lot of potential to create training exercises with augmented reality wearables.
That's fascinating. Thanks for sharing. What type of research projects you think would be involved with sports ophthalmology moving forward?
Well, of course, I think that I'm excited about a project that we're currently working on, which is looking at athlete perceptions of refractive surgery, particularly for college athletes. I think that there's a missed opportunity right now for a lot of college and professional athletes to undergo refractive surgery and kind of optimize their visual acuity for their sport. And I think that that's something that we need to kind of make an assessment of why that's happening and see if more patients can become interested in refractive surgery to help them optimize their vision.
Yeah, what have you found is some of those hesitations? Why are I know you're doing research on this, but if you could guess, in your opinion, why is that the case?
I think that it's bigger than athletes or college athletes or professional athletes. I think we're seeing a national trend in increased hesitancy towards refractive surgery, or also perhaps at the same time decreased awareness of refractive surgery options. Um, there's been a few uh, articles in the um, general national media that have um, maligned refractive surgery, and I think that that's kind of cooled off the public perspective on those. So I think that um, it's an opportunity for us to present to patients what it's really like and what the benefits are.
So for a resident or medical student or ophthalmologist who wants to get more involved in taking care of athletes, what kind of advice would you have for them?
I would say first, the best way to do it is to find a mentor who's already engaged with a athletic team or athletic program. If you're at a big university center, if you can find, a mentor who's already engaged with the athletic department, that would be, and can get you in the door, that would be awesome way to do it. Secondarily, if somebody like that does not exist at your institution, then approach the AD or the coach of the team of your favorite sport. If you love football, then email the football coach and say, "Hey, I'd love to be your point person for any traumatic injuries that happen for your team," because coaches and athletic programs love to have somebody they can just call and say, "Hey, can we get somebody in?" They're like any other patient where they would love a hotline to the doctor where they can get right in. So even if you're doing that at the resident or fellow level, excuse me, I think putting yourself out there as somebody who wants to take calls, so to speak, for teams is a way to get your foot in the door and get some experience.
So I think I saw on the website that you are involved with the Duke Sports Vision Center. Do you mind talking a little bit about what that entails and what's going on? What's the latest from that center?
Yeah, so a few different things. One is that, I am one of the consultant ophthalmologists for Duke Athletics in general. So that means that, the sports teams, whether it be football, basketball, etc., if there's a injury, then they, reach out to me for urgent visits, me along with, Terry Kim, who's been doing that work forever. And they, we work them in and take care of those athletes. That's one aspect of it, is the acute care aspect, and then mention the screening aspect already that we do. The other thing that we are working on is Duke has a institute or facility, the Duke Sports Science Institute, that is a multidisciplinary facility. So orthopedics and nutrition and training, like weight training and endurance training, all wrapped up in one facility. So it's ideally supposed to be a one-stop shop for athletes to improve performance. And again, through getting stronger, eating right, whether they have an orthopedic issue, they're working through all that. And we're trying to fold vision into that as well, specifically for performance vision. So we have a couple of devices, including the Synaptech device and then the right eye device that we use to assess and then to help train athletes to try to. We also have the Fit Light, which is one more thing that we use for training. So trying to help athletes optimize their performance and focus on any areas that they think may be deficient in terms of their vision. So that's something that's kind of a work in progress. We have a athletic trainer that we're working with to try to build that program up to work with interested athletes. That'd mostly be, college athletes from our school or from other schools in the area. Of course, we have a ton of colleges and universities kind of clumped around us. So there's a lot of interest in that type of thing. So it'd be kind of individual athletes who want to come in and have a comprehensive experience at the Sports Science Institute.
Got it. Do you find that for that vision training that certain athletes from certain sports are drawn to the training?
Definitely. I think baseball is sort of the sport where it kind of has the most history and the most, support in terms of experience of athletes who have done it before. And in the literature, baseball seems to be the sport where it's best supported. And I'd say basketball is second to that in terms of there's some professional athletes who kind of have been out there in the media demonstrating that they've used these type of techniques, like Steph Curry's worked with Fit Light, and that's been publicized everywhere. So, there's been some athletes who've kind of paved the way to make it popular in basketball as well. But baseball is the one where there's the most history and probably where we've had historically the most athletes engaged with us too.
Thanks for your time tonight, Dr. Wisely. Before we let you go, want to ask if you have a favorite sport and if you have a favorite sports team.
Well, there's no easier question than those two for me. I'm a alum of Duke, so I grew up playing and watching basketball. So college basketball is by far my favorite sport, and I used to coach boys high school basketball for a couple of years in North Carolina. So, and then of course the Blue Devils are my team. It's been that way forever. So.
Yeah, good favorite team to have for men's basketball.
Yeah, it's been a great transition to coach Shire these last couple of years. I think the fan base is, of course, concerned with Coach K retiring, but I think most of that's been put at ease with Shire off to such a great start. We're very fortunate.
All right, thanks, Dr. Wisely.
All right, my pleasure. Have a great night.
Thank you for listening to Sports Ophthalmology. To stay connected and learn more, you can find us on Twitter, YouTube, and at our website, sportsophthalmology.com.